The Franciscan sisters have served in many different ways in Dubuque and surrounding area, and we've always been honored to do that. We began our care for the elderly in a formal way in 1905, and finally that led to our opening a new facility to meet federal regulations called Stonehill Care Center in 1978. It was a 250-bed facility. It was a great honor to be involved in the lives of so many people.
So I moved here October 1st, 2013, and moved into a villa. And my neighbor came out, I had a U-Haul truck, and he brought me a cup of coffee. So that was an indication of the kind of kindness that is so prevalent here. I walked in the door and I was amazed at what the sisters had done with the space. It felt like home immediately. I just felt from the first moment that this was a place that you could make home. They have so many wonderful staff members here and there, because that's a lot of people to serve. But they do it beautifully and they do it personally. I've been here 6 years now, so I've had a lot of good experiences. And what I discovered right away is the other residents would invite me into things that were happening, and that's the best way. You can see it on the board posted, but to have that personal touch meant so much, and that was here. And as a result of that, I joined an ecumenical Bible study, which has been wonderful.
After I had the privilege of being hired onto this position, to really get that sense of where people were, their heartfelt commitment. I mean, kind of the spirit of the sisters, just kind of comes out in everybody, I feel like, because people just don't look at the mission written on the wall. They get it, and they're here because of that. And I don't think I've ever worked in an organization where there is that full throttle commitment and compassion from everybody who exists here. This is not a community where you may just see it when I'm interacting with a resident because that's who we're here for. We're also really all here for each other, and when I see how engaged everyone is at every level of carrying the spirit of this mission into the future to sustain Stonehill, that is something you don't see everywhere. Stonehill for a long time has been serving the community need through long-term care, memory care in our skilled area, short-term rehab, and certainly through our assisted living and independent living. When we looked at this 4 years ago, it was evident that the gap that we experienced was in our assisted living dementia care. Many of you have heard the growing need for memory care services throughout the United States, and that is only going to continue. So for Stonehill, as one of the largest communities in the state of Iowa, it wasn't meeting the need of this community. So we very much looked at that and said 4 years ago, where we need to expand is in the assisted living dementia care, but we also needed to look at where we were going with our own assisted living. And we don't have that level of service for our assisted living dementia care. Stonehill serves a 43% Medicaid population in our health center. Other facilities, other communities in the state of Iowa average about a 20%. That commitment and that true mission of Stonehill to always serve those who are in need, we welcome all. So for us to be able to continue to say we welcome all, adding our assisted living dementia care was critical. So where we're going at this point is that we will be increasing the apartment numbers for assisted living by 10, and we will be adding 14 new dementia care assisted living to Assisi Village. Along with that, we'll be expanding the Assisi Village Commons areas, the kitchen, the gathering areas, sun porch, and all those wonderful things, as well as, most importantly, the chapel for Assisi Village. From all of us at Stonehill, thank you for joining us on this journey as our story continues.